Initial investigation is a barium swallow or an
Hmm.
esophagogram. It's an X-ray test where you swallow a contrast liquid. And what they're looking for is this really classic visual sign called the bird's beak.
Bird's beak.
Yeah, the very bottom of the esophagus where it meets that tight LES tapers down really sharply, looking like a bird's beak on the X-ray image.
Hmm.
Above that point, the esophagus is usually quite dilated, widened, because everything's backed up.
Wow.
You also see that the peristalsis is absent. The barium just sort of sits there, and emptying into the stomach is really delayed.
That bird's beak is quite an image. But is that enough for diagnosis, or is there a more definitive test?
The barium swallow gives strong clues, but the gold standard test, the one that really confirms it and tells us more, is esophageal manometry.
Manometry, measuring pressure, right?
Exactly. A thin tube is passed into the esophagus to measure pressures and muscle contractions. It shows key things. Incomplete relaxation of the LES, the pressure stays high when it should drop. It confirms aperistalsis, basically 100% failed peristalsis in classic achalasia, and often the resting pressure of the LES is elevated too.
And does this test help with treatment decisions?
Hugely. Manometry allows us to use the Chicago classification to categorize achalasia into different types. Type 1, Type 2, Type 3.
What's the difference?
Type 1 is classic minimal contractions. Type 2 has the sort of panesophageal pressurization, like the whole thing squeezes at once. Type 3 is more spastic with premature contractions. Knowing the type is crucial because, well, Type 2 tends to respond best to treatments like dilation or myotomy,
Yeah.
while Type 3 can be trickier.
Okay, so manometry gives the type. What about just looking inside with the camera? An endoscopy or EGD?
EGD is essential, absolutely. But its main job here isn't usually to diagnose achalasia itself, although you'll see signs like a dilated esophagus, maybe retained food or saliva.
So what is its main job, though?
Its most crucial role is to rule out other causes, especially malignancy, that pseudoachalasia we talked about. You need to make sure there isn't a tumor causing the blockage. So EGD is mandatory, really, to exclude cancer.
Right, critical safety check, got it.
And sometimes, depending on suspicion, maybe a CT scan or MRI might be needed, or tests for Chagas disease if the person is from an endemic